Or I can should go over there.
Okay, so we'll call the meeting to order at 6:07 p.m. We are going to start with introductions.
Yes. So we'd like to introduce a couple of our new members. So we have Dawn Columbaire, who is here with us. She's and Marty Legislator Proctor, Marty Proctor. So Dawn, I'll let you both kind of, give your backgrounds, but I know that I will just say that Dawn has a DPN with a concentration in nursing education. She has an MS in adult health with a cardiovascular clinical specialty and a BS of science degree with a concentration in nursing. And so I'll let you go ahead and elaborate on that. You have a very long list of things on your CV.
What happens when you get older? Well, my most recent full-time job was working at JCC for the last 23 years before I retired. As in the last 17 of that, I guess I was director and professor of nursing at JCC, Jamestown and Olney. After I retired from JCC, I worked for about 5 years as a nursing education consultant, mostly with programs in Virginia, believe it or not, but I could do everything remote, and some programs in New York State, mostly helping them to get their accreditation together, which is a long list of things, in healthcare, the same old quality assurance and everything that has to happen in healthcare these days. So that's my story. I do have a husband. I have 4 children. I have 6.7 grandchildren or something like that. We have another one due in June. So we're busy with them.
Welcome. And of course, I've known you I'm sure other people around this table too. I've known you forever, so.
Yeah.
I just met her today.
You have not?
No. I know, and behind on the 8 ball.
And then we have legislator Marty Proctor. So he is our legislator for the 18th district.
Correct.
And that is Finley Lake, Sherman, and
Mayville, Chautauqua.
and
French Creek.
and you're also the chair of the Human Services Committee.
I'm chairman of the Human Services, have been since the beginning of last year. So Dr. Altman and Jessica. I don't have all of those credentials. I'm in the golf business. It's my regular job, which is very healthy. But I sell golf carts, which aren't as healthy as walking. But anyhow, Lacey kind of said, we'd like to have you on the Board of Health. I said, I'm willing to do it if that's what PJ wants. So here I am.
Great.
Thank you both for joining us. And so if you don't mind, I know that you guys have kind of been talking a little bit, but if we want to just go around the room real quick and introduce ourselves. Dr.
You want me
Kidder
to
is the
start?
president. Yes.
So I am the brand new president as of the last meeting. My name's Betsy Kidder Elizabeth, but I go by Betsy. I'm an internal medicine physician here in Jamestown. I work at the Chautauqua Center in the Jamestown office. I serve as the medical director there. I've been on the board a couple of years now. Lily and Nay roped me into this as soon as I moved back in 2018. So I got to experience COVID on the board and all the fun stuff that came with that, and many frequent meetings, and happy to be here.
Tariq Khan, pediatrician, over at Southern Tier Pediatrics. Been on the board. This is my 2nd term. Happy to be on the board representing pediatrics and everything else that comes with it, and having a voice for the kids and the families here.
Matt Hanley from the Chautauqua Center and from Jamestown. I'm the representative for Jamestown, and work with Dr. Kidder, and I'm the marketing director for the Chautauqua Center, but I technically work for our foundation, or am employed by our foundation, the Waterfront Foundation, and work with a team of 3 there to carry out various contract tasks for the Chautauqua Center and work in healthcare. I have a background in government. I worked for the city of Jamestown in the mayor's office for nearly 20 years, and also have a unique perspective from that office, and especially in the city of Jamestown, working in housing code enforcement for a few years too. So kind of interesting.
It's gonna be an
When you look at healthcare, yeah.
I'm Tom Erlinson. I'm retired from the JCC faculty, where I taught biology and geology, and been a member of this group since, I think, 2013.
I'm Mike Falk. I was born and raised in Jamestown and came back. I've been back working as an ER doc regionally for about 16 years. And been a county physician for the last 5 or 6 years and involved in EMS for a decade or so before that. I took on the challenge of the interim public health director position this past year until Lacey Wilson took over, and currently the chief medical officer for the county, which involves oversight of the health department, our coroner program, our correctional health program, and EMS. And I am a non-voting member of this board.
And then I've already met both of you, but I'm Sherry Rader. I'm the administrative and communications coordinator here for the health department. So I handle a lot of the marketing and those sorts of things, outreach and education. And I am also, I'm taking meeting minutes and facilitating some of these other, YouTube live stuff.
And I'm Jessica Worsley. I started with the health department back in 2006 as a seasonal employee. I got full-time sanitarian in 2015-16, and then I was appointed director of environmental health in spring of 22. Moving on up.
And we have a few folks not here tonight, but you'll meet them probably next meeting.
Yeah.
Great, wonderful. Okay, do we have any privilege of the floor submissions today?
We do not.
All right, approval of the minutes from January. Everybody has them in front of them. Sherry sent them out earlier. Are there any comments or changes or corrections to the minutes?
I'll second.
So. Okay. All right, we're moving right along. I'm not sure we moved this fast before. Okay, new business, agreements to settle.
So this is where I jump in here. You've got a couple pages of agreements to settle. Most of the violations that are listed here are violations of public water supplies. These are, for those of you who are a little bit newer here, we are tasked with overseeing public water supplies. That ranges from anything the size of a restaurant with a well to municipal systems. So a lot of, when these come in front of you with public water supply violations, a lot of these are from the smaller restaurants, maybe mobile home parks, some of those smaller well-based, serving just a single business kind of system. The public water supplies are required to do basic operation and maintenance sort of activities. They are required to fill out monthly reports where they record their disinfection levels. So if they're using chlorine, they have to say, on Monday it was at this, at Tuesday it was at this. Not everybody submits those reports in a timely manner. When they don't submit them in a timely manner, they get a notice of violation from our office. Many of the folks will settle that notice of violation, but there is the opportunity for them to go to a Board of Health hearing with our hearing officer should they dispute the charge for any reason and want to plead their case. So the list that you see in front of you are the folks who have agreed to settle that notice of violation and paid their fine. So like I said, there's folks who either didn't submit their monthly reports or didn't do the correct sampling in the appropriate time frame.
So you've organized them by number of violation? Is that how you?
I'm trying to figure out how it's going to be easiest for you guys to look at them. And so, Yeah, I want to make sure that you're able to distinguish that sometimes you've got folks or businesses who, you know, something weird happened and it's a one-off kind of, they've made a mistake. And then you do have some of these other businesses that, you know, have repeat violations. So I'm trying to organize it such that you can decipher pretty easily if it's, you know, something that may have been a one-off problem or somebody that we're starting to see a pattern with.
What I'm interested, it's kind of weird to see schools on this list.
Mm.
I don't remember seeing schools on this list previously.
Yeah, it's, I mean,
Interesting.
unfortunately, you know, we do our best, as we've talked previously, every winter, we send out a packet to all of these different sized public water supplies, reminding them what they need to do, the time frame they need to do it in. We even put together a little like Excel kind of calendar for them with check marks in the month that they're supposed to be doing these things. So it is frustrating when we see any violations, quite honestly, because we try very hard to set them up and do as much of the thinking as we can for them on that part of it. But yeah, if it's, you know, staffing issues or what have you, I can't tell for sure what the problems are for everybody. But yeah.
And you have I know we've talked about this in the past, but I don't know if you've looked at it recently. There's a stepwise fee schedule for repeat offenders.
Well, and so it's something that we've been working on, and myself and Natalie Whiteman, who is our senior water resource specialist, we've been looking at what other counties do with their fee scale, and also looking at, because right now the base fee is for the public water supplies is $100 per violation, but it's been that way for a lot of years, and we are looking at making the fine for each violation fit the type of violation better. So for some of these sample monitoring requirement violations, we're getting an idea from the labs who run these types of samples what the cost of that sample is. So that we're gonna start the plan is to try to make our fine at least the amount that it costs to run the sample, and then more to get the point across a little bit. So I'm still working on gathering all of that information, developing things, and then also looking at how we are considering violations. Because if we're considering it violations start at this level for a monthly report, and then at this level for a bacteria sample, and then those are each starting at a base level, or do we start compounding them for any type of violation? We're still sorting out some of that, what we want to do to make it effective. Yeah. So I'm hoping to bring that to the board, if not next meeting, maybe the meeting after. But you know, we wanted to try to flesh out the board a little bit more before we started doing some of those bigger changes. And so then towards the end of the list is the Adolescent Tobacco Use Prevention Act violations. We shorten that to ATUPA. So these violations are for facilities that have sold tobacco products to an individual under the age of 21. Under the ATUPA program, my office and staff do two different types of inspections. We do an adult check where we send one of our staff members in and they look at the signage, they look at the products, they look at that sort of different, just take in the lay of the land kind of approach. And then the second type of inspection we do is we actually bring on a minor, somebody under the age of 21, and we essentially give them a small amount of money and they try to make a purchase at the establishment. My staff stay in the car, the minor goes into the establishment, tries to make a purchase. Ideally, they are denied. They walk back out empty-handed, we fill out our form, everything is great. Unfortunately, at these two facilities, the minor was able to make a purchase. So we then are required, Atuba has minimum violation fines and fees. So for a first sale, the fine is $300, and then there's a required $250 surcharge. So these folks both agreed to settle the not go to hearing, so they paid that fine and surcharge. And then they get 2 points on their facility. Within 3 years, if they get a total of 4 points on the facility, it then gets pushed to New York State Tax and Finance, where they can suspend the seller's lottery and tobacco sale license for a year.
So 2 violations essentially.
Yeah.
Gets in there.
I read somewhere where there was training, that it was different from these. That somebody needed training to sell tobacco, is that the clerk in the store?
Correct, yeah, the facility, like a lot of the corporate, the chains, their employees are all required to do this standardized training. So if a sale happens and the person who sold has done that training, then they would potentially get bargain, I don't want to say bargain, but they would be reduced to a 1 point violation because that training has occurred.
Thank you for explaining all of that. It's really,
It's a lot, I know.
There's a lot behind the scenes.
Yeah.
yeah.
So then so moving along, the next individual, actually did, this is another Atuba violation, sold to somebody under 21. And this proprietor chose to come to a hearing. Once they got to the hearing, let me back up. We try very hard. When a sale happens, staff goes in, talks to the proprietor, talks to, if the proprietor's not there, we have the clerk call them on the phone so we can actually have a conversation with the owner operator. And we try to explain, these situations are pretty black and white. Either they sold or they didn't sell. So folks are welcome to come to hearing, but unless there's some amazing tidbit of information that we're not aware of, it doesn't typically do them a whole lot of good. So this person came to hearing after we had already explained the situation to them. Our attorney, Christy Martin, explained the situation to them again, and upon hearing it from the attorney, they decided that they were just going to settle. So they didn't present any sort of case or their version of the story. They just agreed to settle, but they chose to come to Mayville to do it. So again, it would be the $300 fine and the $250 surcharge, which is the minimum required under the Atuba regulations. And so then this would be up for the Board of Health to discuss if you agree with that, if you have any issue, you want to change something.
Is this the location in Westfield or Lakewood? Is that?
This is the Lakewood one, I believe.
Okay.
Oh, is there one in Westfield too?
Wait.
Sorry. Is this the first offense for this establishment? Because we went through one of these last meeting, but it wasn't the same.
No, it wasn't the
Seller.
same proprietor. No, this is the first offense, at least since that restart of that 3-year time frame that we go on. Yeah.
Just to clarify, if they settled, and I know I'm just wondering for the future, if they settle, but then we impose stricter fines or go against the settlement, then what, and maybe we can't answer that here, but what happens after that?
Well, so for this one, because they did actually come to hearing,
Yeah,
they didn't actually settle. they came to hearing, but upon hearing it, he decided, well, I should have gone with this option. I'll do it here in front of the hearing officer and Christie, our attorney. So
Okay,
he didn't technically settle, but he
fully
He sort of
understood
wished he
at
sh-
that
he
time.
did.
Yeah.
Yeah.
Okay,
That's why it got kicked up here.
And that's, yeah, because Betsy was involved, she was in the room when, when the proceeding started. So technically, the hearing officer did, witness and hear this case.
I think we almost, and this is my personal thought, we have to keep it in line with the previous settlements, even though he came up and it got dragged up to here, but first time violator. We have other examples that we just saw. My thought is keeping in line with that, it's adequate at this time.
Yeah, I'm comfortable with that. I think, like I said, sometimes these folks think that if they come to hearing, something's going to be thrown out or, reduced or whatever. But with a TUPA, I have a minimum that I have to follow. It's stated in public health law. So I can't reduce it more than the agreement to settle that I've already tried to offer.
It seems straightforward. Just a question, if this proprietor at a different location were to have another violation, does that,
It goes by establishment.
it goes by the address?
Now, having said that, we, in my experience as director, which again is rather short, we have never gone above the minimum TUPA standards or TUPA fines. But should the Board of Health want to hear more information on what the maximums are or, what other counties do, I'm certainly open to exploring that if you would like me to.
What if it's the same clerk? Different location.
It's by physical address.
Although so for example, last meeting, we had one of these come to us, and I think we as a board decided to increase the fine on that.
So that was because there was a little bit of misunderstanding, because the sale was actually a second sale in 3 years, but when it went to hearing, not everybody in the room was aware of that. And it didn't get brought up at the hearing, so Betsy, our hearing officer, didn't make the recommendation based on the second sale. She left it open to the board so that I could sort of fill you in that it had in fact been the second sale.
But we as the board have this, when they bring these to us, we can discuss and suggest something different if we think it needs it. But I agree with you, Dr. Khan, that this one seems relatively straight. Any other?
I'm comfortable with the recommendation.
The only thing I'd say is it does actually cost the county money. A little bit extra in attorney and so forth, so I don't want to penalize anybody for exercising the right to go to a hearing. But it does cost more money than if they just said,
That's a great point, yeah, to keep in mind.
What's the surcharge, this 250 surcharge, what's that to cover county fees?
It's just it's in the ATUPA standards as a required surcharge fee. I would imagine that it would be something to the idea that it costs staff time and energy and money to do this, and we do pay a hearing officer to come in. We're not gonna pay her unless they're coming in for a hearing or something. But even without it going to hearing, it's extra staff time for each of these cases that we didn't plan on spending on a violation.
And that's a very valid point.
but when they settled it, the two that settled was $550, and you said that it was a $300 plus the $250.
Correct.
So that surcharge applies to whether they settle.
Whoever,
or-
exactly, it
Right.
doesn't matter if they come here. Do we vote on this?
Yeah, this is up to you. You guys can vote to accept it as written. You can vote to increase. It's up to you.
Does anyone have a motion? Other than proceed? You can provide more.
I would say move with it, but it's a great point that you raised. And we should keep those extra fees or charges in mind, information to the board, because if this comes up in future, we can levy that. Here it appears, I don't know whether it was his lack of understanding, but there'll be cases where there are people who just want to come in and for the heck of it and,
Write it out.
yeah, fight it out, and where we may have to go above and beyond the recommended amount.
I will tell you that I have 5 Atupa sale cases pending, because the next Board of Health hearing is April 4th. No, April 10th, I'm sorry. So at the next Board of Health meeting, I'll either have more settlements or more hearing officer recommendations.
When you offer them their options, you can settle, or is there anything that says that there will be a fee for the hearing if you do not?
It says that the Board of Health may, I forget what the exact language is, but essentially that the Board of Health may increase the fee should you go to hearing and be found liable, yeah.
Any ideas at the top of the head, or I mean, you're the source of information. What is that extra fee that the hearing officer gets paid?
Well, based on what I know that our hearing officer gets paid per hour, and, you know, there's a minimum of time that even if she comes in for something that was an easy case like this where the person settles right there, which doesn't take a lot of hearing time, they still have to write up the recommendation. We pay them for time and mileage. So we're usually paying our hearing officer at least 2 hours for something like this. And we're paying our hearing officer about $100 an hour.
And attorney.
And our in-house county attorney comes to these hearings as well.
I propose that for this case, we move as we discussed, leave it as is, but this was great information and great point raised, especially with more cases coming up next meeting. It's good to keep in mind. Thank you.
Well, and I could try to put together some information about, on average, maybe how much extra time we do spend on these sorts of incidences that might help you guys think about numbers.
Thank you.
It may be a benefit too, Jessica, just to kind of get an idea for the board of just the examples of what other counties are doing in some of those ranges that you mentioned.
Sure.
Not that you don't have enough, work to do already, but, if that information's out there already, perhaps.
Yeah.
It might be good to just kind of take a look at that and see.
And maybe putting a big sign in front of these folks that are coming to the hearing. This can cost you this much extra. Are you sure you want to go to hearing?
I mean, we, and that's why I said even without them going, we have the phone conversations
Yeah,
with
there's
them.
times.
I mean, to try to get them to understand that
There might be
in all
additional.
likelihood, you're going to be found liable because there really isn't a whole lot of gray area in these circumstances. But if they,
Well, once we have some numbers, then maybe it would be helpful to put that in the literature that they're getting, so administrative fees may be in the range of blah, 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 to blah, 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 or something
Sure.
like that. So that sticks out a little bit more, maybe.
Sure. yeah, absolutely.
Do we have a second to Dr. Khan's motion?
Second.
Any opposed? Okay. All in favor, I guess I should say.
Aye.
Thank you. All right, old business. Water updates, that's you again, right?
Oh, yeah, me again. So I guess I just wanted to chat with folks. Fredonia is getting an awful lot of attention, about their water system and, what the village wants to do and what, residents have opinions. And so I just wanted to keep you folks in the loop that Natalie Whiteman and myself are maintaining communication with village officials to ensure that they are getting the most accurate information, that we are providing answers for any of the questions they have. That information doesn't always make it to the public in the same way that we're able to present it to the village officials. So we offered to the village to actually hold a public panel forum where we intend to present, the way I described it was essentially we're gonna follow a raindrop from the point that it falls in the watershed of the Fredonia Reservoir, moves through the reservoir, over the dam, or into the water plant, and out into the distribution system, just to try to help folks have a much better understanding of what actually happens. And as it goes through sort of those different steps, we will talk about the problems that exist currently, our concerns for the future, and the potential fixes for those existing problems. We are also engaging Dr. Courtney Wigdahl-Perry and Dr. Matt Lanning from SUNY Fredonia. Dr. Courtney Wigdahl-Perry is an environmental science professor. She does a lot with water quality. She does a lot with Lutheran algae in relation to Chautauqua Lake. And Matt Lanning is a relatively new geology, hydrogeology professor at SUNY Fredonia. So we just wanted to bring them in because unfortunately, you know, the county still sometimes gets looped together as the county has an agenda. So we just want to make sure that folks are getting the information from us as the regulators, but also from these trusted academics so that they can hear it straight from an academic mouth, not just from somebody that they may perceive as having an agenda. So that's April 10th, no, yes, April 10th, because we did it after the eclipse. April 10th at the Opera House downtown Fredonia at 6 p.m. And we're looking forward to doing a presentation, and then we're going to take questions on index cards so that we can answer people's questions in real time and hopefully clear up some of the misinformation that we've been hearing throughout the community on various platforms. So that's all. I just wanted to let you guys know that we're trying to get good information out there.
Thank you. Okay, Dr. Falk, are you designated as the director?
I certainly can. I can provide a summary of Lacey typed up a report for you guys. If you have questions on that, we can buzz down through some of the highlights.
Yep, so the report, as Dr. Falk said, is included in the agenda packet. I didn't include it in the email, but you do have it in your paper copies here. And we'll be sure to get it out to the folks that couldn't attend tonight. Couple of things that we wanted to highlight here. Item 3 under pediatric dental services. And this is something where the Board of Health, may become involved down the road. But so the University of Buffalo School of Medicine has a rural dentistry program, and it's the mobile dental van. It's been around in Chautauqua County, Allegheny, Cattaraugus County for a number of years. There is a dental advisory board that typically meets that has not really been meeting as frequently as they should. I know with COVID and how a lot of meetings kind of were put on pause and trying to revamp that. There has been a couple of meetings, I think, since COVID, but we had recently reached out to Paula Fisher, she's the program manager for the rural dentistry program in Buffalo at the university there, and just to get an update kind of from her and to schedule a meeting. So we're working to make that happen. But there has been a little bit of movement. So we met with Paula, Lacey and I had a phone conference with her a couple of months ago now, and just to get an update on that. And we were told that some of the funding may be kind of going away. It's a little bit undetermined at this point. And that precipitated a meeting with Dr. Falk, the county executive, Senator Barillo. So Senator Barillo he's working with the state partners just with the money to see if the money that is typically given to support this program. Is it state funds? Is it federal funds? Trying to figure those things out. So he's working on just finding out some more information. Perhaps Dr. Paul, you were there at the meeting, so you
Yeah,
have
we,
some
what we
additional
really want to
information.
try to do is get a group together with some of our elected officials at the state, some of our stakeholders at UB to try to discuss this program because we think it is vitally important. I can't remember the number, it was numbered within the hundreds.
1,200 children are serviced out of this vehicle per year, and the majority of them are actually from Chautauqua County. The Paula had indicated that it's primarily Chautauqua County children, other than so they go to all the schools. Well, I won't say all of the schools, but schools have the option to participate, and there's only 2 or 3, I think, that are outside of our county. So it is primarily Chautauqua County, and it's housed, it's in the parking lot of Jamestown Pediatrics, and they have some sort of agreement there too. I'm not 100% familiar with, but.
We recognize that there's a national shortage of dentists. When it comes to the rural areas, it's such a vital need. And so we'd like to try to work with UB the best we can to continue these services. So I think we're trying to put together a group to further discuss that. So.
Are these UB dental students?
I don't know the model exactly. I feel that the model was perhaps an attending dentist that oversaw some of the maybe 3rd and 4th year dental students.
So from what I understand, the vehicle has 3 stations, and so there's the dentist and then there's the 2 students, so they can service 3 kids at a time.
And it used to be much more robust. The program has shrunk to quite a bit already in the last few years, and then serving that many children. So I can just imagine if there's funding source becomes available, how many more children, because in pediatric community, we used to see all around the county a lot more flyers, a lot more stations at different schools. I think the funding has been shrinking last few years, so it's less and less spots across the county, less locations. So yeah, it's a great program.
From our perspective, there have been from the UB dental ban, and like you said, I think funding impacts it. I think definitely providers impact it, but they did send out cease and desist letters to dentists and some pediatrics to not refer to them anymore in Chautauqua County at one point a couple of years ago too. So there were
To their clinic or to their mobile clinic?
to the mobile
To
clinic,
their mobile.
yeah,
Who was the
Yeah.
other one there?
from the UB dental.
Well, it's certainly a huge gaping need, so is adult dental, what we're talking about it, but
Yeah,
as you
yeah.
guys know well. But it's, I mean, this would be a great,
And the dental fluoride application program that's been initiated by American Academy of Pediatrics in pediatric offices is not very consistent. Pediatricians are not dentists. You do have fluoride to offer it, but it's a hit and miss. Sometimes the child is crying, the parents are not there for the fluoride application. It takes literally 30 seconds. But so having the ban, and of course, it's not only about fluoride application, it's all the other care fillings and stuff and cleanings. So it's a vital program.
So the other thing that we wanted to highlight is the next item, substance use and addiction. And item 2 there, the newly formed collaboration with the district attorney's office. So Jessica, I think you were going to talk about that a little bit.
So, despite our best efforts with the ATUPA program, there's still some problems that when we take things to hearing and to enforcement, it's a civil penalty, it's a fine. We can't seize any product. There's a variety of things that our enforcement is limited. So we are looking at collaborating with district attorney's office to improve our ability to actually follow up on some of the sales violations that we're seeing. So that's a very newly formed collaboration. So I don't have too much more information on it yet. We're looking at how we can work with them, our staff, their staff. We need to educate them a little bit on the public health law. They can educate us a little bit on what they're actually able to do. And we're going to try to figure out a path together to make more of a dent, specifically with the flavored vape products. Because it's kind of the Wild West out there right now. We don't so much see the problems with the corporate retailers having these flavored vape products, but we definitely see them in these more standalone shops. And unfortunately, the Atuba law is written such that I can't just give them a violation for having the product on site. So unless a product is purchased, I have absolutely nothing that I can do with it. So we're looking at involving, moving forward to involve partners who may be able to do something about it. One of the other concerns is the general safety of our environmental health staff, because while some of these facilities, are good standing, doing the right things, some of the other facilities are exploring all their potential means of income. And my sanitarians, my technicians don't have the sort of safety training and are going into some dicey situations. And moreover, taking minors into dicey situations. So we're looking at being able to find partners who can maybe have more training, have a better understanding of the type of safety risks that they're exposed to.
And so the larger, more coordinated countywide efforts would be like Ken Dahlgren and John Chafee with the tobacco-free Chautauqua Cattaraugus Allegheny, bringing them in, and also Prevention Works, just kind of working together collaboratively with those programs. And then the other thing, also under the same topic or bullet point, substance abuse. I think we mentioned at the last meeting that Steve Kilburn will be joining us at the health department to lead kind of this subdivision, and it lists his priority focus areas here. One of them being improving access for mothers, infants, and children to services and treatments. So as part of the neonatal abstinence syndrome, NAS diagnosis, and trying to strengthen the screening and referral networks in Western New York, specifically with Chautauqua County. You guys might be familiar with Positive Directions. That's Davina Moss King, where she is doing referrals for that type of a thing in Chautauqua County, but wanting to reformalize that network. And so I know there was a meeting recently with Steve and Lacey, and they've been kind of working together just to see what more can be done, and obviously not wanting to duplicate any efforts, but working with the Chautauqua Center, UPMC Hospital, and that pediatrics offices as well.
Davina can use some help. She's one person show. We had both of them. Very busy.
Yeah.
So one thing, we brought Steve on. We had an interest in bringing Steve on into the health department to sort of take a public health approach to this significant problem, not only in our community, but nationwide. A big part of Steve's job is to work with the county legislature, specifically Human Services Committee and Audit Control, to work together to try to figure out ways to best spend and put to use our opioid settlement funds, of which we are allocating a significant amount of that money right now to our medication-assisted treatment program within the county jail. We initially had, for the first couple of years, upwards of, and I'm still trying to get confirmation of this, but approximately $2.4 million, with about maybe $250,000 up to $400,000 a year coming in indefinitely, probably up to the next 10 to 15 years perhaps. So part of what Steve's challenge is to work with the county legislature to try to figure out how best to employ those funds throughout the county. So Steve brings a lot of experience in this realm. He's been leading the Chautauqua Substance Abuse Response Partnership, the CSARP, for the last several years, of which Matt, you attended a lot of these meetings. And so that partnership, that committee has kind of morphed into more of an advisory board to help kind of look at what our community needs are. And it's stakeholders from pretty much every angle throughout the county. That advisory board, sort of the genesis of that, was part of this, half of that, I think, or a big portion of those opioid settlement funds that came through OASIS. So they required an advisory board of sorts. So there's a lot of stakeholders that are looking at, how best to employ these funds. So we will be leaning heavily on the advice and advisement of the Human Services Committee and the rest of the legislature as we move forward with some of this stuff. So the biggest challenge right now is finding funding for our medication-assisted treatment program within the county jail. We're looking at an annual cost of approximately roughly $800,000. We're $700 and some thousand dollars for 2023. Probably similar, maybe a little bit more for 2024. It's a very busy program. Medications are very expensive, and
they're not covered by Medicaid while in the jail.
Right. As of right now, we're hoping that might change. There's some talk that the governor has something in her budget to help in that regard, but we're not entirely optimistic. So unfortunately, those incarcerated individuals cannot access health insurance. Seems a bit silly to me, but it is really 100% local share taxpayer dollars that are funding this program.
Mandated by the state.
And it's a mandated program by the state, right? So completely unfunded. So, for now, some people are banking on the opioid settlement funds, but the reality is it's really only going to carry us for a couple of years. When 2025 comes, that budget's going to look, from the health department's going to look totally different. But Steve's going to be a great resource for us. So.
Yeah, so, I'm sorry.
I was just gonna say, maybe the cost of the medications will come down significantly.
Yeah. Well, there's the new one on the market that may be a little bit of a competitor, so it's in Sublocade. Injectable
Yeah,
drugs is what it
Both
costs.
inject-
quite a
There's
bit
more
of
than one
money.
injectable
Yeah.
on them,
So
which are
maybe
the best coming out of jail, because you
Yeah.
know you've got a month to get them
Right.
stabilized and then to services.
And it's so resource intensive, for, just oral medications. We have a number of people on oral medications, but it's very resource intensive to try to avoid diversion of medications within the jail. And so the injections have worked well, and we've had a lot of really great feedback from individuals that are receiving it. So, and I will say that, I'm going to knock on wood here, but the first couple of months of this year so far, overdose deaths have been way down relative to the previous first few months in other years. So, I'm hopeful that we're moving in the right direction. I'm hopeful that we're making a difference within the jail.
So what do you attribute the reduction to?
Well, my hope would be that we have, all of these community groups so heavily involved. We said at the CSARP meeting, there's probably 15 to 20 different stakeholders from across the county that are just battling this every single day in the front lines. Steve led a couple of really important grants over the last few years for the county. My hope is that that's making a difference. We're seeing a lot of trends. One of those is the the age of overdose death is going up. It's somewhere in the upper 40s. We're not seeing, thankfully, the young people dying as much. So we're hoping that the efforts in education in our high schools is helping. But there's still a lot of work to do. I mean, the reality is 2023 was the highest overdose death rate year that I don't think we have the final tally of the numbers yet that we've had so far, and that's all based on fentanyl. We don't see heroin overdoses at all. I review every autopsy, every coroner case within the county, and we don't see heroin. It's all fentanyl, and oftentimes, and most oftentimes, combined with methamphetamines and cocaine. So there are those themes that are pretty common. I will say that we hardly ever, out of the probably somewhere around 60 deaths for 2023. A very small handful, one or two, have Suboxone, Subutex, methadone in their systems, hardly any of them. So it tells us that those folks that are in treatment are much, much less likely to die. And so part of Steve's initiative, and it's written in Lacey's director's report, is to improve access to treatment. And with that, very big
Which is
emphasis.
a big shift in the mentality of providers over the last 10 years to keep people in treatment even when they're using other illicit substances to prevent overdose. So it's just it's like moving a big ship, trying to get people to think differently.
The biggest challenge that we have, and that everybody has in this arena, I think, is treatment retention. It's trying to keep people in treatment. So that's one of the things that we're looking at a number of grants that one of them specifically focuses on follow-up and retention and treatment, trying to get these folks peer support is a big deal. But we're going to keep fighting the fight.
Steve has great experience with grant writing and stuff, so I think
Yeah.
that's going to come in handy.
Yeah.
Just to your comment about changing attitudes, I remember 17, 18-year-olds coming in pediatric offices, and this is years ago. Pediatric providers find out they were using any substance of abuse. All of a sudden, it used to be, well, I'm stopping your ADHD medication. I'm not treating your depression. You just go find somebody else. That has changed dramatically and for the good, trying to find them help. And just because they are using a substance of abuse, not to, even in our pediatric and adolescent population, not to ignore their other problems, not to say, go find someone else and send them on their way. So that's been a positive.
No more discharging out of treatment.
Right.
Yeah.
Keep them in.
Yeah.
As best we can. So,
Can I ask you a dumb question? What's SUD treatment?
Substance use disorder. Yeah.
There's going to be nothing's
There's a lot
done.
of acronyms.
No, I'm not afraid to.
MAT is medication assisted treatment,
Yeah,
which
yeah.
is also from Suboxone.
I'm familiar with that. Jim.
Yeah.
And there's MOUD, which is medications for opioid use disorder. So there's a lot of acronyms out there.
There's a lot of acronyms.
Yeah,
Yes, it's, yeah.
keep asking.
We have the CSARP committee, but we have the SARP program in the jail. We have.
That's always confusing.
We have a lot of that.
Can I just ask a curiosity question on the Hep A outbreak?
Yeah.
What happened with that? Do we have any significant disease burden?
So so the outbreak as listed, it was an individual at the Cracker Barrel that tested, a worker there that tested positive for hepatitis.
Yeah.
We don't have any reports of other illness. Jessica, I don't think you've heard of anything, right?
No.
So Erie County, Pennsylvania, their health department was very proactive in contact tracing, getting people vaccinated, as there's about a 2-week window to get that prophylaxis accomplished. We obviously took the approach of knowing that a large number of people go to the Cracker Barrel from Chautauqua County. So we did get some information out to the public. Erie County, PA ran out of vaccines pretty quickly. So we employed New York State to send us some, I think there was 80 or so, right? 80,
Yeah.
80 doses of vaccine that came from New York State through us. We sent them over to Erie County, PA to help them out.
I think we vaccinated about 20
Yeah,
of
we
our
had about
own
20,
residents.
I had 4 patients just of my own who called me and said, I hated the Cracker Barrel. I was like, come on in.
Yeah, yeah,
But
yeah.
I had no idea it was so popular that so many people drove out there for that.
Chicken biscuits.
I guess.
Is that chicken biscuits?
That's why I got the expressway.
Yeah.
But this is this highlights the importance of early intervention, a very aggressive public health approach to contact tracing and getting people taken care of and educating them. And we did not have a huge outbreak, in our county. I don't know, I can't say for sure that Erie County PA didn't have other cases. I don't know that. But, we did hear of many. So.
Can I ask a curiosity question too? I don't know where it falls, but with the TUPA and all that, with cannabis coming in, are you going to be responsible for that?
So cannabis falls under New York State Office of Cannabis Management. We are not involved in it. In fact, if I see it on a shelf in a store, I use the same complaint form that everybody else uses to notify Office of Cannabis Management. We don't have any sort of insider track to notify anybody.
So
Yeah.
Jessica, I don't mean to put you on the spot. If you don't know the answer to this question, it's okay. But in thinking about all of this and knowing that there are going to be dispensaries at some point in time throughout the county in different locations, could the Board of Health have, some type of role, play some type of role in, say for an example, we wanted to say in Chautauqua County, we don't want a dispensary opened up within so many blocks of, or so many feet, or so many miles from a school, or something.
There's
like that.
already those regulations.
Is that already?
Yeah, that's
By
in,
state,
yeah, the state does
churches.
have standards already. I mean, I think, I'm not positive because I'm not positive how it all rolled
Yeah.
out, but my understanding is that the state was leaving it up to the municipalities to decide if they wanted to implement stricter standards on shops and locations. I don't know if Board of Health
Which could fall
could,
Hours of
Depending on how-
operations and all that.
yeah.
maybe something that we'll have to become a little more educated about and really look at those current laws. Because and the only reason I ask is I think that from a health department, I've said this before, our biggest priority with all of this is going to be our children.
I just will say, I did sit through a presentation by somebody from Office of Cannabis Management at my last Environmental Health Director Conference. And what they said is that once you are a facility that actually does have your certificate through New York State, those are not the facilities they're seeing problems with, because the process to get that certificate is so time intensive, so difficult, that those folks are not messing around. They are doing things by the books. It's all of the other folks that are making up their own
Yeah,
game
that
plans that are the
makes
problems.
There's a big investment for the two, so they don't want to jeopardize that, but
But we have time, so to your point, we can get ahead of it and then look at some of those ways and means. How could we be better prepared rather than trying to get on the train when it's already moving? And so we do have a window of time.
the train's moving. I mean, it's
Yeah.
legal,
Yeah.
it's delayed.
Yeah, and that's where the opportunity is, because that little delay, so if as a board
Yeah,
of health, we need to look at and put some things in place or at least get moving.
But so the state's not looking to the county board of health for any, or Department of Health for enforcement or anything like that?
No, because it's penal law, it's law enforcement is involved. The difference with the tobacco is that it's essentially public health law, it's civil law. So law enforcement isn't directly involved in tobacco regulation, whereas cannabis regulation, like I said, law enforcement is directly involved.
Maybe you guys can form another little subcommittee of working together with the legal law enforcement as it relates to
Public health.
Cannabis. Yeah, interesting distinction there though.
Oh, let's go ahead.
Well, I was just gonna say, I mean, that it's one of the things that myself and many of the other environmental health directors and public health directors around the state push back on, because law enforcement is involved in alcohol sales, it's involved in cannabis sales, but somehow or another, public health sanitarians are following up on tobacco. And it seems a little ridiculous to me. So we push that point every time we can.
And that was a question. I mean, we find the TUPA violators, but there's no criminal
Right.
repercussions on that. It's a controlled.
Now, you guys are Department of Health, but the American Academy of Pediatrics, every state and New York also has a lobbying firm that they pay, and this lobbying presence is in Albany. So if it ever comes to it, and need to, I don't know if it'll go anywhere, but they do have an ear of quite a few of these legislators who are from downstate and sometimes have the governor's ear. So it's a tool we have used quite a bit of to further things for kids and agendas and stuff. So that alignment can always happen between the Department of Health and the counties and the pediatricians across the state and go to the state.
That's a good thing to keep in mind, yeah.
Yeah, there's a voice there.
The thing about the cannabis that really pisses me off, part of my trenches, the gummies and the packaging of the gummies. Nothing that we can do on that, but.
We've got all this
Especially the kids.
legislation on the flavored
So, yeah.
nicotine, and now we've got candy looking cannabis.
Drugs.
It's so much more potent than what it used to be, too, so.
Well, I don't know, what you guys see in your clinical practice, but I can say in the emergency department that it is a very common occurrence that we see young people with hyperemesis syndrome, abdominal pain, uncontrolled vomiting from high levels of THC.
Too many gummies,
Too many, yeah.
because the first gummy didn't kick in quick enough.
And the misconception is that, right, marijuana helps with nausea. And so it's this vicious cycle. Well, I'm sick to my stomach, so I have to take more. It spirals out of control. It's a real thing. And young people, I can't tell you dozens of young people that I've seen in the emergency department over the last, however many years that suffer from this. And interestingly, but the only thing that helps is an antipsychotic called Haldol. It's the only thing that helps these folks.
They work drug, still works.
When you say young people, 20s, or
Yeah.
teens, or
Late teens, early 20s, they seem to be more susceptible to it for whatever reason.
And trying to teach them that the cause of the cyclic vomiting is the THC. It doesn't seem to stick.
Doesn't, yeah.
My youngest one that I've seen, what Dr. Falk is talking about, is a 14-year-old.
Hmm.
And the parents kept taking him to the GI doctor, thought it was a GI bug. Till when he kept presenting to the ER every so many weeks, and I'm like, oh.
Scromiting, that's what they call it.
Yeah.
That's
Well-
the term for it,
scrum.
scromiting. That's, yeah.
The
I
term-
just had to look it up because John Chafee from Tobacco Free told me that term this last week, but
Yeah, we actually had Melanie Witkowski with Prevention Works. I mean, this was a few years ago, so I don't know. Dr. Erlinson and Dr. Khan, you may have remembered her coming in and giving a presentation about that, and I remember.
that term.
Yeah, so she was talking about how high the THC levels are, so much higher than what they were in the 70s, and the difference between the, marijuana back then versus today.
Big, big difference. Yeah.
Well, if you call their 800 number, they say if you smoked marijuana years ago and haven't done so, go slow, because things are so much stronger, right on the New York State. And I was a town board member in the town of Minot when we were considering opting in, opting out, and I was trying to do research on it. I remember calling, and it was just interesting.
Well, we certainly don't want to demonize, legitimate business owners who are doing things perfectly by the book and legally. But we do want to make a big emphasis on protecting our children's brains up through adolescence and early adulthood. I think it's really, really important. And I think it's a really important public health message to get out there. There's a lot of data to suggest that the earlier, adolescents have marijuana, alcohol, whatever it may be in their brains, the more likely they are to form a dependence on certain things in life. And the longer we can prevent that exposure, the better, and the data shows it.
There's a side to it, though. Not all of it is recreational, though a little percentage of it is, and not to further, but it is. A lot of those young adults and teenagers that are using drugs of abuse, marijuana being one, have mental health issues. They are self-medicating. So identifying those earlier, wherever they are getting their care, GP offices, pediatric offices, school nurses, they're going, identifying and getting them that help. That prevents a lot of those addictions, and it could be any of the substance abuse. That's where we see a lot of 8 out of 10 kids, adolescent patients that we see who are abusing alcohol or cannabis or other. On screening, they have underlying chronic anxiety, depression, untreated ADHD, and I think that's another thing to keep in mind. That connecting them with that help is important.
Does the Department of Health have any public health education campaigns in the coffers for marijuana targeted at kids, or?
We do. We've talked about those things. Sherry has a lot of knowledge on our social media, educational programming, communications programming moving forward, and it's something that we are always working on. But I don't know that we've talked specifically about marijuana in kids. I've thought about it. We've had some discussions here and there, but we need to. Yeah.
I was just thinking about how you were saying that overdose deaths were looking a little bit less in the first few months. And is that a result of fear of fentanyl after everything we've seen? And maybe fear is what these kids respond to.
Right. That's a good point.
Not that you want to put fear in all your public health messaging, but sometimes looking at it.
Well, it's honesty.
Yeah.
I mean, functionally, that's the reality of what's out there, yeah.
And considering that we're coming off of one of the largest years of overdose deaths, it is now considerably yearly. So we have some other things on the director's report that you all can kind of review at your leisure. One thing that we wanted to just mention, not that it affects the board directly, but I'm sure you're all aware of the updated CDC recommendations for COVID, and now that it is considered respiratory illnesses. So they've lumped it with all of the other respiratory illnesses, and so it's got some new recommendations. Stay home and away from others for 24 hours. If your symptoms are getting better or you are fever-free without medications, then just take added precautions for the next 5 days. So those are the new recommendations. And then the measles, well, I skipped over the eclipse. Not that that's not a big part of our community right now. So you probably, or hopefully you're all aware of the eclipse glasses that the county has provided. And so we've got a big media, the county-wide has a media campaign out just kind of promoting that, and glasses are available at lots of different locations throughout the county. And yeah, if you're in need of glasses, well, you can take some with you today. But we have a list. You can get to it through that flyer. You can scan the QR code. But hopefully you've seen some of the media about it.
Yeah, I thought it was well publicized.
That's good. Good. I know Justin Gold, our media information officer, has put a lot of time and effort into that over these last few months.
The
And then,
county's website looks great and the new campaign and things, even someone like me who doesn't go much on the media and stuff, I'll get a little template in there, so it's looking great.
good, thank you. And then lastly, measles. We included a little flyer just so you can see some of the outreach that we've been doing with our, been promoting this on social media. We had a press release that went out and also have a web page for that. As of March 14th, there's a total of 58 measles cases in the US in 17 jurisdictions. New York City is now listed as one of the areas, so that's a newer from 2 weeks prior. Every couple of weeks, the CDC updates its guidance, but as we know that vaccinations it's the big catch up, still trying to catch up from COVID, and so just encouraging those MMR vaccines. I don't know if you have anything more to add on that, Dr. Falk.
No?
Our numbers weren't that terrible though. I was looking at some of the vaccination numbers because when the county comes every year and does the vaccine reviews, there was a little bit dip generally across in the county, but compared to some other counties in New York, our docs, our healthcare providers did a pretty good job. It wasn't terrible.
Yeah, somewhere, we looked at the numbers countywide, somewhere around 85% of our kids are vaccinated, so it's a really high number.
Yeah, we definitely are higher than some of the other counties within the state, so that is a good sign.
You lost a nurse at the jail, so something.
Yeah, we do know where she is.
She's missing.
That is a big worry of mine right now. Once COVID hit, you guys know very well, a lot of medical professionals, especially nurses, just left the field. Hospitals specifically have been, smaller hospitals especially, are really struggling, or have struggled over the last couple of years with premium pay, paying travel agencies for travel nurses, humongous demand for nurses everywhere, nursing homes, private practices, hospitals. In our case, we have had an issue with retention and recruitment of nurses within our county jail. We are not competitive with salary at this point in time.
You guys said some good bonus, something you instituted to get a few people to sign.
We increased their work week from 35 hours to 40, so they have additional 5 hours. Right now, we're looking at doing a sort of a salary wage comparison across the state to try to figure out how bad that disparity is. Preliminarily, it's a really huge disparity. We're at the point where, if we lose another nurse, keep in mind that these are mandated services, and it's a high-risk population of people. These folks are acutely ill coming into the jail. If I told you some of the things which I'm going to avoid and fear I'd violate HIPAA, it's almost like a mini emergency department on a day-to-day basis coming in to the jail. And these medical needs are high. A lot of mental illness, upwards of 60 to 70% of the individuals have substance use disorder issues, whether it be opiates or alcohol. A lot of acute withdrawal. We're trying to get on top of them as quickly as we can with medication-assisted treatment. But if we don't have the appropriate services within the jail, things are gonna fall through the cracks, and we cannot have that happen. And so I look at Mr. Proctor because I think we're gonna have some serious conversations coming up about what we do to tackle this issue. We don't actually, surprisingly, we don't actually employ a huge number of nurses for the county. I mean, there's a dozen or more, a little bit more than a dozen nurses across the county, but it's important work. That's not because I'm sitting next to Dawn, because if I said anything, she's within reach of punching the arm, but it's extremely important work, and it oftentimes, goes unrecognized, the value of our nurses in our community. In fact, the jail is calling me right now. Take that. And we have to do something to retain and recruit nurses within the county. It's just, we have mandated services that we have to take care of.
I think you said oftentimes these inmates and the people that come in, that's their only medical. They refer to the jail doctor as their primary physician.
Yeah, it's not easy work either. I mean, we're trying to recruit out of the same pool you guys are, as a resource center and all the others.
Yeah.
And we have 4 openings, 5 openings right now.
You have to stop telling everybody how terrible it is.
Yeah.
Because nursing admissions programs, it's down. It was up during COVID, and now it's not considered, the thing to go into. So this is the first time in about 20 years that we haven't had huge, waiting lists of individuals to come into the program. So reach John Governors and help.
It's certainly job security. You can get a job anywhere.
Well, specifically for correctional health, I think I have found making that transition over the last, 1 or 2 years into this world of correctional health, it's very rewarding. And I oftentimes tell people that I get more thank yous from the incarcerated individuals across the street every day than I ever would in an emergency department. They really appreciate the care that they're being provided and making a huge difference. And I think from a nursing perspective, it's easy for me to say, I guess, that it's not all about the money. But it's really more about the reward of doing what they're doing.
It used to be research-wise that the highest job satisfaction was working with the prison population in nursing, and that we saw a lot of longevity in that population. I don't know where it is right now, but I concur
You
with
gotta
what
get
you're
in the
saying.
door for the interview first. So.
Yeah, that's true. But when we're talking about $20,000, $30,000 wage disparity over the course of the year, that's going to probably drive a lot of that recruitment effort.
Did we lose this nurse because of that?
Yeah. So.
Anything under the other category to be brought up? Nothing.
Well, I've had conversation with Ken Dahlgren in the last couple of days and about smoking. And Ken's in New York City right now. And he said he would be happy to come to our next meeting and discuss the situation. So.
All right, we'll put you on the agenda for the next meeting. Okay, we have our future meeting dates down there. If there's nothing else, can I have a motion to adjourn?
I'll move to adjourn.
First motion
I'll
for
second.
tenure. All right. And they're
Get them in the minutes.
Thank you.
Well, hour and 25 minutes.
That
Pretty
is
good.
record.
That's
That could be record time. We didn't have anything too controversial on the back.
Yeah, all the time the kids in the
We'll see you all in May, it looks like, right?
post eclipse.
Post eclipse.
Yes.
We'll put this snow will be gone by then.
Yes. No more Lyme disease.
It's spring out, did you know?
I know.
The snow
Yes.
festival in the town where they sprayed it.
My house, the family.
Everybody's good. Keep them all from being sick. I get, kind of few